Hello, community. This is Kelly Calabrese, and today I'm here with Dr. Fonda Melby. Dr. Fonda, thanks for being with us.
You bet.
So glad you're here. So, Dr. Fonda and her husband Lee, they own Milestone Veterinary Care in Minnesota. So she's all bundled up there because it's cold, and so we're sending some warmth your way. And their practice is really about sports medicine for Western performance horses. So they are all about performance, about horses being well, about getting back to high levels quickly. And so, Dr. Fonda, tell us about how you first heard about Renovo.
I had a client that asked me about it. She has had a horse with a hind suspensory branch injury, and she had been contacted by Ginger from some Facebook information she had put out there and asked me if I would be willing to try it in her horse. And at first, I was very skeptical, but I spoke with Ginger as well as Christian and Dr. Heggie in Oklahoma about this type of injury and how he had used Renovo to treat injuries similar to that and the procedure and everything. And so we tried it on this gal's horse, and within 3 months, the horse and also some rehab as well went back to full performance at the level that it had been performing at prior to the injury, and it had been off for almost a year prior to the Renovo injection.
Wow, that's exciting, and we love that. We're seeing that even horses that have, old injuries. My daughter had a horse with a scar that was 3 years old that she bought. That the Renovo, even a 3-year-old scar, made a difference. So we love to hear that, and it gives hope to people who have horses with older injuries that Renovo could be a solution. What's another example of Renovo case that you've come across?
I had a case of squamous cell carcinoma of the conjunctiva of the eye, and that horse, the cancer developed pretty rapidly, and we took the horse to an ophthalmologist to get an opinion on what they would recommend to treat it, and they had recommended debulking and even part of the cornea and using like a conjunctival flap over the cornea, and the expense of that procedure as well as the prognosis was not very good. So we chose to just debulk that lesion and then use topical chemotherapy. Well, within 6 weeks of the chemotherapy being finished, the mass had started reoccurring pretty rapidly. And so I told the owner that we could try Renovo and see if it would help. I mean, kind of what our next option was going to be was enucleation of the eye. And so what I did was debulked the lesion again and injected 1 cc of Renovo into the conjunctival tissue by the lateral canthus of the eye in this particular horse. And the lesion is completely gone, and the horse is performing at its top level, and it can see, and you would not have can't see any evidence that there was a lesion there prior.
Wow, that is incredible, truly incredible. And there are so many issues out there with horses with eyes, and to know that this could be a solution that Renovo can not only help the condition but get their sight back is really, really encouraging. So I appreciate you sharing that story. And I know you and your husband are also big time competitors, equestrians, and barrel and team roping, and you do rodeos and maturity. So, what would you say to some of the other athletes and competitors out there about Renovo?
Yeah, I have used this product just even as preventative type treatment for synovitis and other milder joint conditions. So I do think it's an option in the performance horse that may be having some mild arthritis or mild synovitis, even though it is more costly. The benefits of it could last longer in their horse as well as prevent further damage over time versus using corticosteroids. It's also a really great option in young horses where you don't want to potentially cause harm to their cartilage with using corticosteroids. So I would consider it for many different types of treatments. We've used it in soft tissue, joints, and then also in the case of that eye that was not related to a joint or like a tendon or ligament injury at all, and it has benefited it. So
Wow, so
amazing
many
product, and we're, yeah, really happy with it.
Love it. That's exciting. And how about what would you say to other vets? I know anytime something new comes along, there's obviously, it's normal to have a little bit of skepticism to try something new, but what would you say to the vets out there?
I guess as far as the veterinary community goes, I have seen that this product has benefited soft tissue injuries more than PRP or IRAP has for me, or like ProStride. And so I do go to this product more frequently than I use those other products now as far as regenerative therapies. So,
Wow. Well, that speaks volumes. We so appreciate you being out there, being a voice for Renovo. The company is growing. We get excited when more vets like yourself are out there sharing what you're seeing in the field. I mean, for real. I mean, this is it's so exciting. So thank you for giving us the medical perspective as well as what you're seeing in the trenches as an athlete. That's really encouraging to us. So, Dr. Fonda, thank you so much for your time, and we look forward to another interview with you in the future.
all right, thank you. Have a great day.